They come in, we get their medical clearance, we make sure that their health is well, and based on their health, our medical director or physician assistant, nurse practitioners, it's a collaborative team effort to make sure that you're getting the best treatment as a patient.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Tanaz Rezavi Arman of Masters Med Spa, who's dedicated over a decade to honing your skills in aesthetic medicine and skincare. Tanaz is committed to professional development and is an active member of the American Society of Laser Medicine and Surgery. She's currently pursuing her doctorate of nursing practice at California State University, Long Beach, where she is dedicated to advancing her expertise and leadership in the nursing profession. She is also a published author with articles featured in Dermascope magazine and on platforms like BravoTV.com, OK Magazine, and Women'sHealthMag.com. She has also made appearances on the television show Real Housewives of OC and the podcast Rick and Kelly Unmasked, showcasing her influence in the aesthetic community. So Tanaz, welcome and glad to have you here.
Thanks for having me.
Yes, let's dive right into it. How did you first get interested in aesthetics?
I actually started with a laser med spa, and it was strictly lasers. And that was right when I graduated nursing school and just excelled from there.
Nice. Now, I want to talk about some of the treatments that your clients and your patients come to you the most for. What would you say some of those common treatments are?
Right now, because the industry changes so often, I would say it's soft wave, ultra clear skin resurfacing, and microneedling and laser hair removal.
Okay. So it seems like the lasers is the ones that you do a lot of. So would you mind kind of explaining a little bit more of why would someone want to come in, get a laser treatment, and really what are the differences between all, because there's so many laser treatments out there, what are the differences between them?
So with laser resurfacing, it's a lot of skin tightening, fine lines, wrinkles, everything that's going to be for sun damage, so why lasers? Laser resurfacing, hair removal, laser skin tightening, everything that has to do with the foundations of aging, I love to do. So laser resurfacing helps with fine lines, wrinkles. You have pigmentation issues. You have the crepey skin that we can tighten. With soft wave ultrasound, high energy tightening, it's shrink wrapping the skin. So there's a lot of treatments that we do that doesn't necessarily need the no sun exposure or the prep, but lasers are becoming a foundation in the all holistic skin tightening and regenerative skin health.
Okay.
A lot of beauty behind being able to do a lot of different lasers during even off season, just to help your skin give it the best glow that it has.
Okay. And for the lasers, is something that you typically want to stay with just one type of laser treatment, or is it okay to mix and match different ones, maybe not at the exact same time, but using multiple different types of lasers as part of your overall treatment?
Absolutely. Layering and collaborating different lasers at different times or even at the same time stimulates and boosts collagen better, but you don't have one laser that targets everything. So you have a 1064 for bulk heating and collagen remodeling. Then you have a 755 that's for pigmentation. You have your resurfacing lasers that are between the erbium, the YAGs, the CO2s, and right now the newest one is a cold fiber erbium YAG that's a 2910 nanometer that really helps stimulate collagen with the least amount of downtime. So we are on the forefront of laser resurfacing to be able to layer different treatments together. You can do a soft wave with a microneedling. There is no limit to how you get that skin tightening when it does come to just refreshing your skin.
Okay. And when it comes to lasers, I think maybe some people who've never gotten the treatment done before may have this concept in their mind that, oh, it's a laser, it's going to just burn the crap out of my skin, or is that part of the treatment? So could you talk a little bit more about that? Like, does lasers really burn the skin in a way to heal it, or does it work in a different fashion than that?
So the term laser doesn't necessarily mean that it's going to completely ablate your skin. You have fractional ablative, you have lasers is the medium that the energy is going through to help either target melanin, hemoglobin, or vasculature to resurface or improve the texture and tone of the skin. So what you're having with lasers is you can have one that fractionally ablates or one that full ablation. And when I talk about ablation, it means taking out little microchannels of tissue or full resurfacing of the tissue on top, the epidermal tissue. That's one version of it. You have another one that just targets pigmentation. You have another one that just targets your broken vessels. So being able to layer different types of these modalities really helps give you that ultimate resurfacing and rejuvenated look.
Okay. And when it comes to the lasers themselves, how would somebody know that, oh, laser treatment's going to be a good option for them? Why can't they just do things like putting lotion on or just trying to get more sunlight? Like, where does the laser treatments really come in, like the best scenarios where someone would want to use it?
A lot of our patients come in for a resurfacing of some type. You can use your lotions, you can use your potions, but at the end of the day, if you have been out in the sun and you just are normally aging, the skin does have an ability to pigment or get dehydrated. So as much as the skincare, if you've started at a young age, you may not need laser resurfacing, but your laser resurfacing can help with the fine lines and wrinkles from sun damage. It could be your laugh lines that you want to improve on. It can be the broken vessels from allergies that you've had and you want to reduce the appearance of the redness that you have, the rosacea that you have, the smoker lines. So you can preventatively do a lot of great skincare using retinol, sunblock, and topical creams and lotions. But at the end of the day, to refresh that top environmentally damaged skin, you would need a nice resurfacing.
Okay. Now you talked about skincare. I want to talk about skincare a little bit deeper. Maybe, I mean, we talked about the laser part of it, but specifically the skincare part of it. Like, what is your general approach to skincare? How people should view their skin? How should they should view taking care of their skin, really for longevity?
Always, always, always use sunblock. No matter what it is, use sunblock. Sunblock can be medical grade is obviously the best. There's tinted sunblock for the people who don't want to use too much makeup. But as far as skincare goes, your first and forefront when it comes to protecting your skin from environmental damage is sunblock. As far as skincare in general, you need a good cleanser, and there's a plethora of cleansers out there, but medical grade again is the best. So what we recommend is something that either has mandelic acid for people who are acne prone or have pigmentation, or have more mature skin. You can use a dental cleanser, something from like Elastin, Skin Medica. These companies create cleansers to gently exfoliate the top barrier without over exfoliating. And when you get stuff over the counter, it's usually not as medical grade and potent. A nice gentle light. I mean, to talk about skincare, it really depends on the person's skin. You can sit there and say, hey, they need a alpha hydroxy, beta hydroxy cleanser, or they need a toner, or they need retinol. It really depends on the individual themselves, what they need to counteract on what's going on with their skin or even the environment that they live in.
Got it. Now, when it comes to, you mentioned always wear sunblock. Now, how important is just getting sunlight in general? I mean, it's if people think about, okay, I need to wear sunblock. So does that mean that I need to avoid the sun also, or should there be a certain amount of sun that they do want to get, but just make sure that they're being protected? What would you advise to someone as far as how much sun should they get or not get, or how much should they avoid?
That's a great question. I'm not here to tell people not to go out in the sun. Sun is obviously really good for our mental health, but you do go out in the sun, wear your sunblock. If you don't go out in the sun and you're just driving around, wear your sunblock. I'm not one to say never go out in the sun. I joke to my patients that once we do a treatment, stay out of the sun as much as possible, but that's more for the areas that we have treated because we are damaging the top layer of the skin. We are causing a controlled injury, which makes your skin more vulnerable for pigmentation issues later on. So when we say avoid the sun, It's more of when you have an injury to the skin, it will hyperpigment or hypopigment as opposed to just normal healthy skin that would get tan. So it's more for a concern of the areas that we are treating and not your full body.
Okay. So when you mention as far as putting sunblock on or protecting yourself from the sun, not completely avoiding it, but protecting it, are there certain areas that they need to focus on more? Like, should they really just focus on sunblock on the face and the arms, or but ignore the hands? Or is the arms okay, but you really want to protect your face? Are there certain areas of the body that you really want to focus on protecting from the sun? Or is it you want to protect everything?
Protect everything. A lot of our patients that come to Masters Med Spa are getting their hands, their arms, their neck, décolleté, face, knees, everything treated. And anywhere your sun exposure happens, there will be sunspots, there will be crepiness, dehydrated skin. The sun breaks down the hyaluronic acid in our skin and therefore causing it to be more wrinkly, to look crepey, to kind of get that elephant thickness. On top of having pigmentation, broken vessels, you can get the redneck, or we call it pegyloderma of savant. So it's more of making sure that you are just protecting yourself overall so that you don't not necessarily get dark, but it's protecting you from the UVB and UVA lighting from the outside and inside.
Okay. And for people that want to have more of a tan tone to their skin, is there a safe way of doing that?
So we safest way would probably be getting a spray tan, but when it comes to laser hair removal or skin resurfacing of those areas, we can't necessarily do it because spray tans have augmented and additional pigments like copper undertones that actually would react with the laser. So you think heat with metal and it'll explode and burn the skin.
Wow.
So, I mean, it's a fine line between being aesthetically tan and being having healthy skin.
Okay, I'm glad that you brought up that difference. I don't think many people would have thought about, oh, if I had just have a spray tan and then go get laser, it's gonna be fine. It's not gonna blow up their skin.
We always make sure that we review that with our patients so that they don't go into that risk.
Okay. Now, and then this is a perfect segue. I want to talk about how do you approach educating your clients on the benefits, the treatments, just like we talked about now, so that they don't blow themselves up. But how do you approach education? Because I'm sure you get a lot of people that come in, they're not quite sure what they're looking for. They just have no knowledge of the things that you know. So how do you approach that educational piece?
It's twofold. So one is what is it that the patient comes in looking for? What are we trying to target? What do you what do you want to improve on? What's making you unhappy? Why are you here today? And then having a conversation of what it is that's gotten you to that point. So during our consultations, we thoroughly discuss what is it, what's going on, how do we prevent it, and how do we fix it from here so that we can maintain the best results.
Okay. And I'm sure that you get a lot of people coming in with common misconceptions or myths or beliefs that are just not correct. Would you mind sharing maybe a couple of misconceptions that you hear very, very often from your clients that come in?
If you use Botox for life, you'll never need laser resurfacing. Uh, Botox is, or any neurotoxin, is a fantastic way to relax the muscle so that it doesn't cause deep stagnant lines. But laser resurfacing isn't necessarily just for the loss of volume or the stagnant lines that are created. We can do a lot of laser resurfacing for acne scars, and overall texture and tone of the skin. So a neurotoxin can help kind of make you look refreshed, but it doesn't help the integrity of your skin.
Mm. Okay. And so,
Another one.
yeah, well, actually, I have a quick question on that one first before we go into the next one. So, when can people use both the laser and the neurotoxins into an overall treatment plan for them, or are they kind of mutually exclusive? I just want to use one or just use the other.
No, so we have the four pillars of aging. It's the loss of bone density, loss of volume, you have skin laxity, and then you have tone and pigmentation issues. So with neurotoxins, you're helping the muscle aging and you're helping the areas of muscle contracting where your skin has gotten too thin and you see that contraction. So over time, it causes a wrinkle in the skin texture and tone. Uh, when you're doing lasers, you can mix it with neurotoxin and filler and a skin booster like Skin Vive or help it heal faster like PRP and even use soft wave. So we have a combination treatment here that we use soft wave, ultra clear laser resurfacing, PRP for an overall skin tightening or rejuvenation treatment. It's not exclusive to one treatment or another. The reason there's so many items in our toolbox is because we're able to use different things to help augment or just refresh the skin.
Got it. Okay. So then going back to the common misconceptions, what was that? What's another misconception that you hear quite often?
Another misconception would be if you shave, it will cause the hairs to grow thicker. Where when you're shaving your hair on your body, it's actually cutting the hair shaft in half. And therefore, the growth feels more stubbly, but it's not necessarily. It's just the before the hair was tapered out, and now it's just bluntly cut so that we have a nice area to laser.
So it's just a old wives' tale that if you shave, it'll come back in thicker.
Absolutely.
Okay, got it. Now, Tanaz, I'm curious, what role do you believe artistry plays in your approach to client care? So when people think about medicine, artistry is simply not an adjective that they would describe to medicine. But when it comes to aesthetic medicine, I think that has a bit of a different role than your traditional medicine. So, what are your thoughts on the importance of artistry or creativity in how you approach client and patient care?
That's such a great question. I would say that artistry has to do with being aligned with the patient's views of what beauty is. Everyone has their own vision of beauty. Everyone has their own definition of beauty. But when it comes to aesthetic medicine and what here at Masters, what we're trying to accomplish is more of a natural approach to replacing lost volume to making you feel the way you did at your best and not augmenting. I mean, augmentation happens everywhere. We can make bigger cheeks, we can make bigger boobs, butts, whatever it is that the patient wants. But when it comes to artistry, we have to educate our patients of what we're trying to accomplish and how that vision would be translated as opposed to, okay, I'm going to give you lips or I'm going to give you a chin or a cheek or whatever that may be. It's we are trying to support the volume that you've lost in the mid-soof or the piriform to bring back that rejuvenated look as opposed to what it was when you felt like you looked hollow or sad. There's a recent study that just came out that Botox or neurotoxin in the glabella region actually can help people who have depression, and it improves the psychological approach to an individual's self image and self confidence. So, as a practice, as aesthetic medicine, our goal is to make patients feel better about themselves and not fixate over different issues. It's more of my image of artistry is being able to artistically fulfill a patient's wants and needs through the tools that I have.
So, what happens if you, I'm sure this has happened to you, what happens when a client comes to you and has just a very unrealistic viewpoint of what they want done, or if they come in, I'm sure that you had people come in with an Instagram photo that's heavily doctored and filtered, like I want to look just like this. What do you
Yeah.
do in situations like that?
I have a very popular saying, I'm a beautician, not a magician. Can only do so much. If they want to augment their face to that point, then I'm not the person for them. I can't. I know my strengths, I know my weaknesses, and if somebody comes in, it's a very delicate conversation of, I'm so sorry, we cannot do this for you, and hopefully we can find you the person that can, or have that conversation of what's really going on.
Mhm. Now, what are your thoughts on social media as far as social media has obviously helped grow the aesthetic industry, just being able to share before and afters and just share your work. Then there's also the bad side of it where people just have these unrealistic expectations that we talked about. So do you
Mhm.
think that social media overall has been a net positive or a net negative for the industry?
That's another great question. I think it's been a net positive. There has been a lot of exposure. There's been a lot of education that's happened from social media. Unfortunately, just like with any other industry or any other field in the world, you're going to have the extremes where people share untrue, invalid information. And it's our job as aesthetic providers and as medical professionals to educate what the truth behind each treatment, each service is. So, in total, I think it's great that we are finally getting the word out of all the great new things that are in our industry, but doing it delicately so that patients understand what it is for and what they can do. And specifically for them, it may not be the same type of result that they would get with some other treatment. So it's sifting through and being able to share what's actually true and what's not.
Got it. Now, Tanaz, I want to shift a little bit more to the practice. So, what would you say is really the main things that differentiate your practice from others in the industry? Because it seems like nowadays med spas are popping up left and right. So, how do you really separate yourself out from the crowd?
We at Masters have four amazing providers, and each one specializes in their own craft. So, Allison is our injector queen. She knows she's a trainer for Revance. She's just over a decade of experience when it comes to injections. I myself do a lot of lasers alongside with our my other co-partner Cheryl, who's also a laser specialist, and then we do wellness with hormone pelleting and weight loss injections and peptide injections through our physician assistant Catherine.
Hmm.
So having a team that everyone's been doing their craft for over a decade and know what they're doing and specializing in what they're doing puts us apart from all the other med spas.
Okay. Now, I have heard stories of people going to providers who are set up in their garage or in their backyard, and then they're getting the product from Amazon or Temu or who knows where they're getting it from. What would be the most important piece of advice you can give to someone as far as who to choose, like who to choose to get an aesthetic procedure, aesthetic treatment from, and not getting pulled into, oh, this person is half the price or a third the price, they can't be that bad. Yeah, they're in the backyard, they're in the garage, but they can't be that bad. Like, what would be the most important piece of advice you can give to someone who's considering that situation?
I think if you are going to see somebody in their garage, there's a low standard there. Uh,
Mm.
I believe word of mouth. Follow somebody, have a referral, make sure that you are speaking to people who are trusted, who have a license. You can check everyone's license and just have a little bit of a background history in what's going on.
Okay. Because I think that, well, at least that I've seen with other practices, is that someone comes to them, they say that, oh, I can get this done a whole lot cheaper somewhere else. They end up going there, they mess up that treatment, then they have to come back to the original practice to get it undone and then done properly. So they actually end up spending a whole lot more because they didn't get it done right the first time.
Yeah,
Is that
it happens often.
wow? Okay.
It happens often. And I mean, you have these people who end up going to Mexico or other other areas of the world and getting treatments done. And it's not necessarily bad aesthetic practices in Mexico. There's fantastic doctors and providers in Mexico or other parts of the world. It's just having that trust and knowing that they are a medical provider, they are giving you what they're saying they're giving you, and that you're worth the price that you are paying because aesthetic medicine isn't cheap medicine. The products themselves are very expensive. So there should be a red flag that goes up when you're seeing a very highly discounted price for something because there's a standard in those industries that we all have to maintain and we have to make sure that we have the best quality products for our patients and educating them and consenting them and making sure that they know what they're getting. But at these places like a garage or buying products from Temu or Amazon, I mean, who knows what you're getting?
Well, very well said. Now, Tanaz, I'm curious, throughout your experience, I'm sure that you've had some pretty challenging cases that have come through your door. Would you mind sharing a story, maybe one that comes to mind of just a tough case that came in and really how you were able to work through that and get them a great outcome in the end?
I think all cases are tough cases,
Mm.
because it's not necessarily a recipe for what you're doing. We have a very systematic approach in how we treat our patients. They come in, we get their medical clearance, we make sure that their health is well, and based on their health, our medical director or physician assistant, nurse practitioners, it's a collaborative team effort to make sure that you're getting the best treatment as a patient. And no patient is simple. No face that you treat is going to be easy. And so it's an understanding that everyone has a high expectation of their best appearance. And for you to communicate that and understand that, I think is the hardest part for everybody.
I think you brought up a very good point in here where you mentioned that everyone is maybe not a tough case, but everyone's unique. But you still said you have a systematic approach to everyone that comes in.
Mhm.
So it sounds like you need to have both. You need to have that process, that step-by-step process that when everyone comes in, you standardize that. But every individual is just that. They're an individual. They have a very specific case, a very specific need, and a very specific situation. So you still need to have that flexibility within that process to make sure that they're getting the best result that they're looking for. Did I understand that correctly?
Absolutely. You can't have anyone just show up and say, okay, we're going to do a day of lips. But somebody lips are all different. You have lips that look like a clutch and they can only hold so much filler. And then you have lips that can hold a lot more volume. And so giving one syringe for everyone across the board with the same type of product doesn't really work. You really have to cater treatments towards each individual and make it really specific towards what they're looking for.
Okay. Now, where do you think the future of SX is going?
Oh, I love this question. Aesthetic medicine is definitely evolving and it's standardizing in a way that is becoming more medicine and not car salesy.
Hmm.
I I feel like a decade ago, fillers and neurotoxins and all the injectables were just kind of a free-for-all and everyone was injecting everything. But now aesthetic medicine has definitely evolved and changed and grown so much in how we treat patients and how we approach patients and actually calling them patients and being able to we're 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 injecting temporary implants, we're augmenting skin, we're improving skin texture and tone, we're doing pre-cancerous resurfacing. So there's a lot of beauty in trying to get aesthetic medicine to a point where hopefully I hope in the next decade it'll be a part of a roster where we can bill towards insurance and that medical medicine in general see that patients need this. It is a service that's needed and that should be supported by insurance companies and not necessarily just a cosmetic treatment that they do.
And as part of that standardization that you talked about, is that also, do you believe, more of maybe not regulation? Well, I guess regulation is a word for it, but like having more regulation in the industry where there's a certain level of quality for the products that you have to carry, or a certain level of, like, as we talked about before, kind of removing those bad actors from the scene where it's people working out of the garage or in their backyard. Like, do you believe that the standardization is also trying to remove some of those bad ones and really bring up the standard for the entire industry just to protect the patients?
Absolutely. Everything we do is to ensure proper care and patient privacy and patient safety. So if you are having someone doing laser resurfacing in their garage, I mean, there's so many red flags as far as cleanliness and safety that goes on within those borders that we do need to, as a community, do better in making sure that we are standardizing treatments and making sure that it's in the proper facility and that the patient's in its safe hands.
Okay. Now, Tanaz, what is your vision for Masters Med Spa?
Uh, we just want patients to feel good about themselves. The vision is just to make sure that we have the best, we provide the best, and we just make our patients happy.
Great answer. Now, Tanaz, I have one last question for you, but before I ask it, I do want to point people to your website at masters-medspa.com. Now, last question is, what does beauty mean to you?
Beauty is what you feel. It's not what you see in your eyes. It's just a nice, good feeling.
Okay. Well, there you have it. Tanaz sharing her expertise. So Tanaz, where can people contact you in the practice?
Through masters-medspa.com, also at laser@masters-medspa.com.
Okay. Well, Tanaz, it was a pleasure having you on. Pleasure talking with you and getting to learn more about what you know about the industry.
Thank you, Daniel, for having me. This was wonderful.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.